This short video clip is designed to teach the anatomy of the normal angle using this beautiful piece of artwork by Lee Allen. This is a normal, wide open angle with 2+ iridocorneal angle pigmentation in the posterior portion of the trabecular meshwork. In this short clip, we will go through each piece of the angle one by one. We'll start with the iris. I think it's easiest to start with the iris and work one's way around over the iridocorneal angle and up to the cornea. One can see the furrows very clearly from this view as opposed to the slit lamp view. The next structure is the ciliary body face. The ciliary body face is visible in angles that are relatively deep, but is not visible in all angles. Some patients who are hyperopic will have the insertion of the iris right at the scleral spur. The ciliary body face can be many different colors. It tends to be wider in myopic individuals. It's wide in aphakia and pseudophakia, and it is pathologically wide in ankle recession glaucoma. The next structure up is the scleral spur. The scleral spur, as you can see in cross-section, is the structure to which the ciliary body attaches, and it's via pulling on the scleral spur that the ciliary body opens the trabecular meshwork. In this patient, the scleral spur is seen easily as a bright white line because of the pigmentation in the trabecular meshwork and the pigmentation of the ciliary body, but it's not always so easy to see. Pigmented trabecular meshwork, as one can see from the side view from the sketch on the left, is pigmented because this is a part of the trabecular meshwork over Schlemm's canal, and this is the part of the meshwork through which the fluid passes into Schlemm's canal. Over a lifetime, pigment will be deposited in the pigmented portion of the trabecular meshwork. In young individuals, it may have no pigment whatsoever. The anterior part of the trabecular meshwork is the non-pigmented portion, simply the part of the meshwork between the pigmented TM and Schwalbe's line. Schwalbe's line is the anterior border of the trabecular meshwork. It is overrepresented, I think, in some of these Lee Allen paintings, but if you look at the right side of the painting, you'll see that Schwalbe's line is difficult to identify on its own. That's why we use the corneal wedge that we'll talk about in a minute. This is the transition zone between corneal endothelium and trabecular meshwork endothelium. And the next structure up is the cornea. We don't often use gonioscopy to evaluate the cornea. In this painting, you can see the corneal wedge. The corneal wedge has two beams of light, a bright internal beam of light, a fuzzy external beam of light that join together at Schwalbe's line. In the section on techniques for difficult angles, we describe how to use the corneal wedge to identify Schwalbe's line and therefore identify the beginning of the trabecular meshwork. The other thing that one can see on this painting is that this patient has an iris process. Iris processes are normal structures that go from the iris up to the trabecular meshwork. They bridge the angle without bringing the iris up to the meshwork like a synechia. When they're frequent, they can be associated with Axenfeld-Rieger's syndrome. So this has been a brief overview of the normal iridocorneal angle to prepare you for studying gonioscopy.